Tonight, 2 Iowa nursing homes have a COVID-19 outbreak. This as more than 3 months after staff and residents at long-term care facilities got access to the COVID-19 vaccine. Local 5's Eva Anderson spoke to a concerned woman whose relative lives at one of these facilities in Polk County. And Eva, this woman told you she believes the staff are refusing the vaccine.
That's right, Stephanie. There's no state or federal law requiring healthcare workers to get the vaccine. And this woman I spoke with believes the absence of such requirement is the reason her family member's facility has more cases confirmed each day, more than 20. I spent the past 2 days trying to get answers from the facility and looking into complaints filed against them. And because it's so sensitive, the relative who I spoke with asked for her name and identity to be protected, so we'll refer to her as Jenna in this story.
As of this week, it's been 55 weeks.
These days, all Jenna can do is count the days her loved one has been alone.
55 weeks, and of that, she's only had 13 45-minute visits.
It's a far cry from the daily visits Jenna used to pay her relative at Urbandale Healthcare Center. Now, since COVID began, Jenna's loved one has spent 373 days without seeing any family, and it's taking a toll.
She's lonely, she's getting dementia, and I think it's gotten worse.
Now, Jenna's barred from seeing her relative again for at least 14 more days because of a COVID outbreak more than 3 months after Iowa nursing homes got access to the vaccine. And Jenna thinks she knows why.
Very, very upset, just furious about it.
Urbandale Healthcare Center is one of 2 Iowa long-term care facilities experiencing an outbreak, according to the state COVID website. While it currently lists 9 active COVID cases at their last update, now it's nearly triple. Jenna shared emails with me that she received Tuesday afternoon. Those emails say 7 staff and 17 residents have tested positive in the last 2 weeks. 24 total cases. So how could COVID get into and continue spreading in a long-term care facility where everyone had access to the vaccine months ago? There could be a number of answers, and I thought the nursing home staff might have the best guess.
Good afternoon, Urbandale Healthcare Center.
I tried calling the nursing home to reach the head administrator several times. This is Eva Anderson. I also sent her an email with specific questions, asking about the vaccination rate of staff and residents, what COVID precautions they're observing, and what they're currently doing to stop the outbreak from growing. But the administrator in Urbandale wouldn't take my calls or call me back.
Send me what it is that
I did receive a call from an out-of-state acquisition company who said they manage the center in Urbandale.
Yeah, I handle all the media.
They said they'd send me a statement by 5 p.m. I never got one. Since the healthcare center wouldn't provide official answers about the outbreak, Jenna is left to draw her own conclusions.
I've spoken to staff over the last few weeks. Some staff would say, oh, well, it's my personal choice that I didn't have the vaccine. And I've heard 2 different staff people tell me that.
Nursing home staff, some of them upper management, according to Jenna, refusing the vaccine. That is their legal right. But Dr. Tim McCoy with Mercy One South Des Moines says it's dangerous.
Everyone should get vaccinated especially if they're working in those facilities. They don't spend their whole life at the nursing home, so they're going to be exposed to other people. And those other people could have COVID. They're not aware of it.
Dr. McCoy acknowledges even if everyone's fully vaccinated, they could still contract or spread COVID-19, but it's rare. And if nursing staff aren't getting vaccinated,
that's potentially a huge issue.
I also wanted to know if Urbandale is still observing COVID precautions like face masks and shields or social distancing. Well, since they didn't return my emails, I decided to look up complaints filed with the Iowa Department of Inspection and Appeals. While they don't have any COVID safety-related infractions, there are several others from last year. In January, they were fined $500 for not completing background checks, including background on elder abuse on staff members prior to their start date. And in July, a report shows they failed to provide a resident with proper hydration. That resident needed to be hospitalized. Then there were several pest control complaints. Jenna thinks this history shows a pattern of lack of care, and she feels it's unfair that potentially unvaccinated staff get to live semi-normal lives.
They're the ones that go home every night to their families, to their friends. They're the ones that drag it back into the facility.
All while she waits for the cases to stop climbing. And she'll continue counting the days her family member sits there alone.
And Eva, what are Jenna's plans for her loved one now?
Well, she's currently searching for another long-term care facility for her loved one to go to. And I checked around to see how other Medicaid assisted living facilities in the metro area compared. And out of 44 long-term care facilities in the metro listed on the federal Medicaid website, the average rating is about 3.5 out of 5 stars. Urbandale Healthcare Center has a rating of 2.
And you mentioned that the state COVID site only reports 9 cases at Urbandale, but you said there are actually 24.
Yes, according to those emails that Jenna sent me today, there are 24 active cases, according to the nursing home. And we reached out to the Iowa Department of Public Health and let them know about the discrepancy, asked them why. They said they're looking into it. And I do also want to mention, I never ended up receiving that statement from their management group, Campbell Street Services, which is an out-of-state company.
All right, Eva, a lot of work you did on that story. Thank you so much for that.